Hi everyone, I'm Chloe Mabbott from Forum Ego's Animal Therapy. This webinar is going to be on equine lameness identification. This is a two-part series, and I've also done one on canine lameness identification. So if you're interested in that as well, then go and check that one out too. So basically, just like the canine one, I'm going to go through what is lameness, how it is graded, and therefore that sort of applies to what the vets do, and also what are the signs we look for when assessing lameness. And this is where I'm going to talk about obviously the things that you guys can look for with your own horses. So first off, what is lameness? There's lots of different definitions of it, but essentially it's an abnormality in what we would consider normal movement, okay? So it could be movement with a limp, but it's a symptom or a clinical sign. So equine lameness has been defined as an alteration in the animal's normal stance and or mode of progression caused by pain or mechanical dysfunction. A more up-to-date definition has been alteration of the normal gait pattern as a result of functional or structural disorder of the locomotor system. And another definition has been a clinical sign, a manifestation of the signs of inflammation, including pain or a mechanical defect that results in a gait abnormality characterized by limping. Therefore, you can see that they're all really similar. They're all to do with something underlying. They're all to do with pain, and they're all to do with an alteration in movement. So a lot of animals are asymmetric. A lot of horses are asymmetric. Doesn't always mean there's actually lameness, because no one is perfectly symmetrical. So this is when we then need to start to try and work out the differences between when pain is present and it is a real issue, or when it's just weakness and asymmetrical movement. So there's lots of different lameness grading systems. This one is by Ross in 2010. But you do see ones that sometimes go up to 10 rather than up to 5, but they're all based on a scale basically. That obviously 0 is sound, 1 is a really mild lameness, and whatever is the highest number, whether it's 5 or 10, is the most severe lameness. Grading it can just be quite helpful if you're wanting to monitor progression or wanting to monitor change, so that you can start to understand whether they're going up or down a scale. And obviously if you're trying to compare to each hind limb, for example, if they're both lame, which one is more lame than the other one. But not everyone uses a grade or a scale. And obviously you guys don't need to use a grade or a scale. I'm just going to tell you some really useful things to look out for, but those things are often noted in this scale. So for example, I'm going to talk to you about head nod and pelvic hike, and as you can see, that makes a mention in the scale. So it can get really complicated. This probably looks quite complex, and there's a lot of research on forelimb and hind limb lameness and quadruped compensatory mechanisms, so obviously dogs and horses, and on different lamenesses: forelimb, hind limb, upper limb, lower limb, different joints, multiple lamenesses, so it can get really complicated. What I wanted to do with this is to show you how it can seem complicated, but actually this is indicating something very simple. So what we basically got on the left hand side here is a lame right fore. So what this is showing is when the lame limb is in stance, the wither and the head don't drop as much as when the sound limb is in stance. So what we like to say is down on sound. So this is a simple forelimb lameness, and what they're trying to do is take the weight off the painful limb and put more weight onto the non-painful limb. So they'll have their head slightly more raised during the stance of the lame limb and slightly lower in the stance of the sound limb. And that's a simple forelimb lameness. On this side, we've got hind limb lameness. We've got a right hind limb lameness. And what this is basically showing is that during the right hind stance, so obviously that's the limb that is lame, the pelvis is slightly higher than when you've got the left hind limb, which is the sound limb, in stance. So we get what we sort of call a pelvic hike. So it's slightly higher. But what's also interesting to note is what can happen with quite a decent hind limb lameness is that when the diagonal pair, so you can see this, the lame hind limb is in stance, but that means the left forelimb is also in stance and that limb should be sound, is that they go down further onto that limb. So this is where down on sound doesn't work, because technically they're going further down with their head on that left fore, but their right hind, which is lame, is also in stance. But what they've done is thrown their weight off that right hind forward onto that left fore. So sometimes with a bad hind limb lameness, you will also see a down of the horse's head onto the diagonal pair when they're in trot. So technically they'll be going down when the lame hind limb is in stance. But what we look for more with a hind limb lameness is the pelvic hike. So when it's in stance, if the pelvis is slightly higher, then that tends to be the more problematic hind limb. So I'm all about making it simple. I've obviously given you the tip of head nod down on sound, but there's other things you can look at as well. So you can look at protraction of the limb, for example, which is how far the limb is moving forwards. So in the picture that you can see on the screen, the right hind is in protraction, whereas the left hind is in retraction. You can look at their flight of arc, so how much they're lifting up off the ground. Are they toe dragging? Are they getting nice clearance? Are they equal, aka is the left hind equally lifting up the same amount as the right hind? Because, for example, if you've got hock arthritis, which is really common, and for example, if it's in the left hind, then they're not going to lift that up as much as their right hind because they're not going to flex that hock as much. You can also look at things such as if there's changes in musculature. Are they equal both sides, or is one limb reducing its musculature and becoming weaker because there's something wrong with it? And look at their movement in their tracks is what we say. So we say they want to move on 2 tracks. The right hind should follow the track of the right fore and the left hind of the left fore, for example. But are they deviating from that? Are they moving to one side? Are they swaying? Are they swinging their limbs in different directions? So it's good to pay attention to that as well, because that can also note weakness that you can work on before it becomes an issue. But obviously something really important to pay attention to is if there's any heat or swelling or pain anywhere. For example, if you notice the horse is going down onto the left fore, and therefore it could be lame in the right fore, you might want to have a feel there to feel if there's any obvious heat or swelling that's going to make the answer really simple for you. But it's not your job to know where the lameness is. All you need to know is that there's something not quite right with their movement, and that you can then refer to a vet or speak to your therapist about it, and make sure that the horse gets seen as soon as possible. A really good way as well to improve your skills after this video is I've put the lameness trainer. It is a website that's free, and it uses simulated horse videos, basically simulation, to try and show you different types of lamenesses, and really helps train your eye. Okay, so I've got an owner that's really nicely let me use some videos of their horse when they went for a lameness assessment. So I'm just going to show you these 2 videos. Obviously, they're having a flexion test. One video makes it really obvious where the lameness is, and the other one makes it not so obvious, but I'm going to explain to you why. So here's the first video. So obviously it's not the best angle because they're moving away, but there's one key thing that you can really pay attention to, and I'm going to play it again and you'll probably notice, is the heaviness of the landing on the feet. So they flexed the left fore, and then as they trotted off and got into a trot, they landed really heavily on that right fore, which is showing greater weight landing. You can see the body coming down onto that right fore. Therefore, that's showing that the lameness is in the left fore. They flex the left limb, it's exacerbated a lameness, and they're really leaning heavily onto the right fore to try and take the weight off that left fore. Whereas this next video, they're flexing the right fore, and it makes it a little bit complicated to understand where the lameness is, but it's always important to test both sides, but I'll explain to you why. So you can actually see that their head nod has got worse, but they are nodding onto that right fore, and they are still landing heavily on that right fore. But they've actually exacerbated the lameness. So the lameness is still in the left fore, but what they've done is the right fore's been the solid limb. They've had pain in their left fore and they've been leaning on their right fore all this time. And then you've just taken away their compensatory mechanism by doing that flexion test, and therefore, you know, making the nerves impinge, so it feels a bit funny when they go to trot off. So they're a bit dodgy then back onto that limb, but they are still trying to put more weight into that limb, and they are still head nodding onto that side. So remember the down on sound, so it's still showing a left forelimb lameness. I'm going to show that again. So you can still massively hear the heaviness on that right fore and the head nod down. So the answer was lameness in the left fore. It was actually arthritis of the pastern and coffin joints, and they were given treatment and now they are better. So I want to talk to you about some extra things you have at your disposal to use if you need. For example, hard ground can highlight if there's lameness due to a hard tissue like bone, for example. It's not always that simple, doesn't mean that it's not soft tissue related as well, but it can just mean that if they are showing more lameness on the hard ground than the soft, then it might be more arthritic related, for example. But we don't ask owners or therapists or anything like that to lunge on hard ground because that can get a bit dangerous. Save that for the vets. But if, for example, you do hacking on the road and then you do schooling and you notice lameness just on the road, not in the school, it might be that there's more of a bony type change. You can also use circles. So circles can highlight if there's an issue in the upper limb or the lower limb. So if the upper limb, it's often a struggle when that limb is on the outside of the circle. So for example, if there's a problem with the shoulder of the left fore, then when they're on the right rein and the left shoulder's on the outside, that'll often exacerbate the lameness because they can't swing round the outside of the circle as easily. And if it's lower limb, it's often worse when it's on the inside of the circle because it's getting more weight bearing. It's not always that simple. I mean, for example, proximal suspensory desmitis, which is inflammation and damage to the suspensory ligament in the upper portion, and it's often in the hind limb. That can often be worse on the outside of the circle because you're causing a massive stretch to that ligament and a push around the outside. So it's not always that simple, but it can just be a helpful approach. And these are often used in a multimodal type approach if you can't pinpoint the cause. They're not often used as a sole indicator of lameness, for example. So I just wanted to show you here where it's not always the case. This is the same horse you saw a moment ago lunging, and what you can basically see is that they're lunging here on the soft ground right now, and the left fore is on the inside, so that's the limb that we know as the problematic limb. But they don't look too much in discomfort here. Obviously they're going to show less discomfort than they did after a flexion test. But there's nothing particularly worrying about this horse moving around right now. Slightly short striding, but there's no obvious lameness. Whereas if we move it on to the next rein, so now you will see they actually look more lame, and he is particularly going down onto that right fore now. What's most likely occurred here is when they've had a lameness for a little bit of time, so not just a couple of days, is that they start to compensate. So what he's most likely done is try to utilise his left shoulder muscles to hold less weight on that limb, got himself all sore there, so when he's now on this circle where that limb is on the outside, he's actually struggling more because he's having to protract and retract that limb all around that circle, and he's finding that more problematic. And then this is hard ground, so this is safe hard ground at the vets, and you can see here how the left fore is on the inside and he's definitely struggling more now on this hard ground. He's landing heavier on that right fore and dropping his shoulder more onto the right fore, and so seems more uncomfortable. And again, if we go on to the other rein, he's just the same as he was on the soft, finding it harder this way when he's having to stretch around the outside of the circle, and still doing his down onto his right fore. So this is why we use a multimodal approach, making sure that we're checking the head nod, we're flexing and checking range of motion of joints, that we're feeling for heat and swelling, and that we don't just look in a straight line and that's it, and we use different approaches. But as I said, we don't use lunging on hard ground for owners because you don't have a suitable area, so save that for the vets. But it's really helpful to see how it can exacerbate a bony type lameness. As I said, if you notice more problems on a hard ground, on a hack for example, then that can help indicate to you where the problem might be. And then I just basically wanted to show you the difference in this horse of treatment and rest. That you can now see that they're equally weight bearing on both limbs. There's no head nod at all. Both are coming down equally. And that they're generally just much happier. And slow motion, this is a really good tip. Slow motion can be really helpful if you're still training your eye or you're not sure where an issue might be with your horse. Take a slow motion video on your iPhone or on your smartphone if you've got one, and it can just really help train your eye as to where an issue might be. It does distort the sound though, so if you want to use sound to help you know where an issue is, then don't do it in slow-mo, but it can be really useful to look at protraction and retraction and head nod and things like that. And one final horse for you. This was my old horse, Alfie. He's in a Pessoa, so I wanted to put this on to try and show you how it can be more difficult to notice things obviously when they're in a training aid, but what you can look for instead. So this is one particular rein as he's going round, and you could see there he really rushed into his transition. He did take the transition, he took it okay, but he was bending to the outside. He's still bending to the outside now. He starts to rush when he loses momentum. But on the whole, he does manage to do the job. There's some tail swishing, definite lack of balance, but he's managing to do it and to get round. Here's on the left rein. You see again some tail swishing, but the transition was better there. They're still bending to the outside, but the transition was better. But as he started to lose balance as he came around the last corner, it's a very short video, but as he started to lose balance around this corner, he all of a sudden went to rush, if you notice there. Because momentum is going to help him stay upright, because he's not actually strong in his muscles because there was underlying pathology. So what he had was bilateral hock arthritis in both hinds, and he also had sacroiliac dysfunction, and he had proximal suspensory desmitis. I didn't know all of this in these videos, but I did keep pushing because I noticed these subtle signs that he just wasn't getting better, and actually the more I pushed in, the worse he got. And therefore I then ended up finding all that information. What's interesting to note with this is the trot on this rein looks worse. It looked jarred, it looks stilted. I'll go back to the beginning. He's not really got a very great range of motion there. His left hind is very jagged and not really protracting, but his canter's okay. Whereas on this rein, he looks more fluid in the trot, and then he struggles to get that canter transition, and his canter is worse. Now, as I said, with PSD, it's often worse when it's on the outside of the circle, but he also had arthritis. So his left hind was the worst limb. When he was trotting with his left hind in the middle of the circle, he's got more weight on it, more torsion into that hock joint, so he found that harder. But when he was then cantering on the right rein, in canter, the outside limb is the limb that's doing the most pushing. That's the one creating the impulsion. So when the left hind, which is the worst limb, is on the outside of the circle, that's why the canter was worse on the right rein, because it's on the outside trying to push. He hasn't got any ability and strength in that limb to do that, so he finds it worse. whereas when it's on the inside of the circle, cantering, he actually found it easier despite the fact there's more weight bearing down there. So this is where I'm saying it's definitely not always simple. You wouldn't have got from these two videos that he had so many pathologies, but I knew him from taking lots of videos, from lots of times, from monitoring his behaviours in the fact that he started tail swishing more, his transitions got a little bit worse, he started bending more to the outside. Then I was able to pick up on this quickly. Therefore, that's why it's really important for you to keep paying attention to your horses. Keep taking videos, keep taking slow motion videos, keep in contact with your vets and your therapists to really keep an eye on your horse's movement, musculature, and make note of any subtle changes really quickly. So here's just some final hints and tips. Like I'd mentioned before, try and look at all views, so cranial, lateral and caudal, so that's from in front, behind and sideways for a full assessment. Videos can be really handy, and particularly slow motion. Try to establish if the changes are chronic or new, and therefore that's why I say taking lots of videos all the time, constantly assessing is going to make that really easy for you. Remember that head nod trick, so you're down on sound for your forelimb lameness particularly, and if you're hind limb, pay attention to that pelvic hike or any changes in your flight of arc or pro or retraction. Multiple lamenesses take a really long time to train and take practice. Even vets can have disagreements with what legs they think are lame, or use nerve blocks or flexion tests to help decipher, so don't expect yourself to know exactly which limb is lame and where. That's not your job. Your job is to establish that there is something not quite right, there's been a change, and that you need to get professional assistance. So I hope this has been helpful. And if you do have any questions, please feel free to contact me. You can follow me on my social media pages, so such as Facebook at 4 Amigos Animal Therapy, and contact me through there, and I'll be more than happy to answer your questions.